Welcome, everyone, to today's session of the Young Adult Program's Psychosocial Patient Panel and Stories, led by Paige, Sarah, and Christina from the Young Adult Program team and some of their patients. Thank you all for your time. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful for the YAP team for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat feature throughout the session. At the end of the session, your questions in the chat will be used to moderate a Q&A. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us, and I will now pass the workshop over to Paige and Sarah.
Thank you so much, Becca. Welcome, everyone. My name is Paige. I'm the program manager at the Young Adult Program and joined by our wonderful Young Adult Program team, Sarah Fay and Christina Pozo-Keterman. We're so thrilled to be here with you all today in partnership with the Blum Digital Resource Center, and just so grateful for their time and effort in planning this event. So thank you, Becca and team. The Young Adult Program is a psychosocial support program for young adults receiving care at Dana-Farber. So anyone ages 18 into early 40s is welcome to join our program. If you identify as a young adult, we'd love to have you. We provide a variety of clinical services, educational and support programs, opportunities to meet peers, and a lot of resources to get connected with. So this panel is part of our annual Young Adult Cancer Conference held every April. And we thought we'd bring together this lovely panel of young adults to share more about their experience with others, what it's been like to live with cancer as a young adult, and hopefully to help others feel less alone. So without further ado, I'm excited to introduce our wonderful program director and clinical psychologist, Dr. Christina Pozo-Keterman, who will then introduce our fantastic panel of young adults. Christina?
Thank you very much, Paige. So first, I want to really thank everybody here, our panelists, for being willing to do this event with us. We know that it's hard to do these types of panels and share your experiences, so we're really grateful to have you. I thought we would start by having each of you introduce yourselves, and you can share with us anything that you feel comfortable sharing in terms of yourselves, about your cancer experience, and anything else you think would be helpful for our young adults in attendance to know about you. Once the program starts, I will ask questions just so that those in the audience know, and we'll try to really make it a conversation. And at the end, as Becca mentioned, we will have time for questions for you to have for our panel. So I'm going to go ahead and start with Madison. If you could please introduce yourself.
Hello, I'm Madison. I am from Melrose, Massachusetts, just north of Boston. I was diagnosed with stage 1 breast cancer in June of 2022. So I am coming up on my 1-year mark. I had a lumpectomy. I went through chemo and radiation, which have all wrapped up now. And I'm really happy to be a part of this.
Thank you, Madison. Sam, can you introduce yourself next? I'm going by alphabetical order.
Yeah, I'm Sam. I am 29 years old from Swampscott, Massachusetts. I had stage 2 tongue cancer. I was diagnosed in July, and I went through a partial glossectomy and neck dissection, and then 6 weeks of radiation. And as of the end of February, I am cancer-free.
Thank you, Sam. Andrew.
Hey everybody, I'm Andrew. I'm 33 years old, and I'm from Newton, Massachusetts. And I had stage 2E classical Hodgkin's lymphoma with a 14 centimeter mediastinal mass. I always like to emphasize that. I had chemo and radiation, and I finished treatment last July. And they told me I was in remission last October.
Thank you, Andrew. Catherine?
Hi everyone, I'm Catherine. I am 21 years old and I was diagnosed this August with brain cancer, grade 3, when I was freshly 21. And I got brain surgery and then started radiation and pill chemotherapy not long after that. I think I did 45 days straight of chemotherapy, pills, along with 33 days of brain radiation. So I missed a semester of college for that, and now I'm still on treatment. I'm doing cycles of temozolomide, which is like a pill chemo, back at school, and I'll be on treatment till October.
Thank you very much, Catherine. So we're going to go ahead and start with our questions. So if each of you can share, how did the diagnosis and treatment of cancer disrupt your life? Understanding that when you're young and you get diagnosed, you're really at a stage in your life that this is totally unexpected, this diagnosis. So if you could share with us how the diagnosis and treatment disrupted your life. And I open it up to anybody who wants to start.
Yeah, I mean, mine's kind of obvious, so I'll take it to start with. But obviously, I was planning on going back to school, and then all of a sudden, I was in brain surgery, so everything really changed. And I'm a senior, so now I'm walking at my graduation, which is great, but I'm not entering the workforce nearly as soon as I thought I'd be able to. And I'm maybe not able to take on the same experience jobs as I could have had this not happened.
I would say that cancer really infiltrated every aspect of my life. And what I learned is that life doesn't stop for you to navigate it. And you kind of have to learn how it's going to play its role in all of the new aspects of your life. I had a very physical career and I had to stop working and I haven't been able to go back. And then I feel like my friendships have all changed and I'm learning how to reestablish what my life looks like now and continue to move forward from that.
Andrew and Sam, any way that the cancer diagnosis and treatment disrupted some aspects of your life?
So for me, I was in Los Angeles at the time. I was, chasing, a Hollywood dream because I'm a filmmaker. And, I think it was like plaguing me for like 3 years already at the time. I had like a lot of inflammation and like allergic reactions to like foods that I never had reactions to before. And I was just overall feeling a lot of discomfort, fatigue, and just general being like unwell. And it wasn't until I, was moving apartments and I was like bringing a sofa up like 3 flights of stairs and I started getting chest pain. And when I did, I went into the doctors and I was like, hey, I think I've got like a rib sticking out of my chest. Is this normal? And they were like, yeah, it's probably just from the physical exertion. Take Advil for 2 weeks and you'll be fine, right? Cancer is usually just the last thing on their mind when you're as young as you are. And it wasn't until then, after all those self-reporting so much discomfort, they finally gave me an x-ray and they were like, yeah, you've got a huge mass in your chest. But I was feeling that my career trajectory, the jobs that I was applying for, because of my fatigue and my unwellness, the feeling of being unwell, I was applying for easier and easier like jobs. And I had realized that the cancer was affecting me before I even knew that I had cancer. If that makes sense.
And Andrew, you brought up such an important point that with young adults, there's often a long period of time where they have to really advocate for themselves to get the medical attention they need, because cancer is not what is thought of when somebody's young and complaining of something physically. So I think that was a very important point. Did anybody else have that experience?
I had that experience. I went to the doctor, I think it was a year and a half before I was diagnosed with pain in my breast in the exact location that my tumor ended up appearing. And they just wrote it off as a benign cyst, and it ended up developing into a tumor.
I also had that experience. It was the fourth doctor I saw that finally gave me a scan. I thought they were migraines, but it was not migraines. But mine was mine was all in a very condensed period of time. I only started showing symptoms the month that I was diagnosed. But I was having like horrible headaches to the point of vomiting. So I was really not functional at all. So then I just had to keep going back and keep going back until they gave me a scan.
Yeah, and I
Yeah,
think,
I was say I apologize, it's the music class. I had a cut into my tongue for about 2 years. I went to the doctor and he kind of just said it would go away. And I guess with tongue cancer, the cut will go on and off. So although it did go away, it would constantly come back. And after 2 years, one of my best friends, who's a dentist, urged me to get a biopsy. And I got a biopsy in July. I did the Pan Mass Challenge first weekend of August, and I was at Dana-Farber the next day. And everything moved very, very fast after that. They kind of rushed me through the whole process. And it was kind of a lot to handle all at once. But
yeah. So I want to thank you all for sharing that, because I think that really highlights the importance of being an advocate for yourself, and having your family so often also advocate and help out, because when you're young, it's just not the first thing on the healthcare professionals that you see and on their minds. So can some of you share the physical and emotional challenges that you have faced since your diagnosis and treatment? And you can talk about both or just one, whatever you feel most comfortable sharing with us.
yeah, for me, I spent multiple months not being able to speak or eat. I think the most I went about 9 days without being able to eat or drink anything. Just the pain in my tongue was so terrible that it just really messed with me. I had to go to speech therapy. I kind of talked with a lisp. I still have no feeling in half my tongue, and where they did the neck dissection. And kind of right about the time that I finished radiation, I had just like the complete breakdown, and, almost coming to terms with this is what everything is going to be like. And I felt like I had done a pretty good job keeping myself together and just pushing through everything. But like once it was finished, it was, going and realizing what the new normal was going to be like.
And Sam, I wanted you to talk a little bit about the eating process, because that's something we so often take for granted, right? So much of our life is when you socialize is going places to eat with people. And then of course, talking is what we're doing here, what we all do. So I don't know if you could talk a little bit about how you, initially, as you've shared, were only able to really have fluids. And I don't know if you're up to potato chips yet, as we've talked before, but can you share a little bit about that experience?
Yeah. I was on more or less a liquid diet for months. I don't think I could eat soup for a very long time. And yeah, it's the little things that you don't realize that you use your tongue for. So getting food out of your teeth, and like I can't stick my tongue past my lips anymore. And I used to be able to touch my nose with my tongue. So it's like completely learning how to eat, moving food around. I still have trouble taking a bite out of a sandwich because you kind of use your tongue to push it towards the back. And I'm doing a lot better now. I mean, my taste is all over the place because of the radiation, and I haven't really had crunchy food. I mean, I'm craving potato chips and everything, but I've gotten through it. I mean, I would love to be able to lick an ice cream cone, and I know that I probably won't be able to, which is fine. But at where I'm at now, I'm at a great place. I'm able to enjoy food and eat socially. It was a little bit hard to get back to that and be around people because I was very uncomfortable taking food and placing it specifically to the left side of my mouth, and having to have water all the time, and I can't talk when I eat. It took a lot of getting used to, but I'm at a pretty good point right now.
Do others want to share some of their perhaps physical or emotional challenges?
I can share physically, aside from the obvious fatigue of chemo and the pain that my body took on with chemo. I was forced into menopause at 25. I went through IVF to freeze eggs and embryos before chemo. And then when you start chemo, I started getting Lupron injections, which is another hormone injection. So that really took a huge toll on my body. I say I'm a 60-year-old trapped in a 25-year-old's body. And it really has taken over my ability to get up in the morning and just have a normal day from just the day to day. And the other aspect is losing your hair. I chose to do the cold cap, which was really brutal. It is really, really cold and suctions to your head for hours. And following those days, I would have migraines and I would be in a general state of fog. But there's also the nervousness around that not working and losing your hair, which you have your hair your whole life. It's part of your identity. You groom it to be who you are and it grows with you. So that was a really daunting part of treatment to face.
Yeah, I definitely think I can speak to more of the emotionalness of it. I've been very lucky to like physically react super well to everything, which I really do think is just luck. But I think emotionally, obviously, I'm still in treatment and I'm gearing up to do my final chemo cycle at school. And it's just like I have so much more going on than all of my peers. And I feel like there is such like a division almost between us. Like nobody here can really understand that. And that's very difficult for me to do it all alone. I go to school in New York, so I can't go home for my chemo weekends. So it's Friday to Tuesday that I'm like just trying to get through it. I definitely think my family and I had like a bit of an adjustment period when I first came out here and was doing this by myself. Just because obviously none of us have ever done this before. So I don't think they fully knew how to support me, nor did I know really what I was going to need, but I felt so isolated. But things have gotten a lot better in that regard, but obviously it's still very hard. And radiation was also very hard. Like that was so difficult to make yourself go there every single day. And that caused me to lose like this whole section of my hair and some in the back. So I can definitely relate to what Madison said as well.
For me, it kind of goes all the way back to the first chemo I ever had. And I had a very bad, like, adverse reaction to my first chemo. I came home, everything felt fine, and I was experiencing something called tumor lysis, and that's when just a rush of dead cancer cells just rush through your bloodstream, and then you have this huge inflammatory reaction, right? So I was actually in this room at the time, wasn't sure what to expect after the first infusion. And I was basically having a very, like, seizure-like reaction to it. It's called Reiger's, and I'm just like shaking, and my teeth are chattering so much that I thought, my teeth are going to shatter. And I was just struggling so hard to just like unlock the my phone just to dial 911. And it was my first time, riding in the backseat of an ambulance, like looking, at my home street in reverse, right? And Hodgkin's lymphoma is generally, like, you hear all the time, that's like a very curable form of cancer, relatively. But at that point, I was convinced that all the rarest side effects that you could ever get were to happen to me, and my luck is just that bad, is what I kept thinking. But I guess what I'm trying to say is that in terms of emotionally, I feel like I have to deal with uncertainty a lot more, even to this day. Like, there are times when you just think, like, could this cancer come back? Is my luck that bad? And I just try to find ways to cope and relax with uncertainty if I can. And usually I try to meditate, or do some deep breathing to return my thoughts back home, to see the truth for hopefully what it is, and not let my perspective or my biases take over my mind. So I think that can be like a constant battle sometimes emotionally. But yeah.
So I always give a pause to see if anybody else wants to chime in, but I think you brought up a really important concern for pretty much everybody who gets diagnosed with cancer, that living with the uncertainty, right? Once something like this happens and you're young, it does sort of change and the way you think. And I think that living with uncertainty, or if you want to call it anxiety, right, is pretty common for many people. Has that been the case for any of you besides Andrew?
I think Andrew talking just very much so reminded me of like my initial story and diagnosis, which was quite traumatic. If anyone knows anything about brain cancer, I was told basically that they thought I had a glioblastoma, which is like the worst possible one. Most people are dead within a year. And I was told I'd be lucky to have like 15 months to live. And so I was like just turned 21 years old, grappling with this in my head, because it takes, and I was told this by multiple doctors just based off looking at the scan prior to the biopsy. And the biopsy takes about like a month to come back. So me and my family we were facing this whole reality. I mean, I was thinking about terrible things, like what I wanted them to do after I died, like with my body. Like, that's not a normal thing to be thinking of as a 21-year-old. So I definitely felt like, but then when I was told I did not have a glioblastoma and I had another cancer, which is still, as of right now, uncurable, but I could live far longer with it. It was just such relief based off not having that I think that makes it much easier for me to deal with what I got, because it was such a relief. Yeah. Which is somewhat ironic.
Yes. One of the things that several of you have shared with me in terms of some of the emotional and physical challenges has to do with fatigue and, just when you're young, you take for granted that you could just go, go, go all the time. And so I'm just wondering those challenges in terms of fatigue and the change in your ability to sort of cognitively process information. And if you're willing to share how the impact that has had on your life, whether it's work, school, or just in any way living your life, in terms of exercise in your body and things like that.
I think that when we talk about fatigue, it's something that everyone has experienced at one point in their life. But when we talk about fatigue from cancer treatment, it's really something different that I'd never experienced before in my life. And I like to describe it as a debilitating fatigue because it really knocked me down and I felt like I couldn't get back up. I couldn't get out of bed in the morning. I couldn't go to the grocery store. I couldn't make myself a simple peanut butter and jelly sandwich. And I've always been a really independent person. So relying on other people felt really foreign to me. And also I felt like I was missing out on my prime years of my life. Everyone says your 20s are the best time, or 25 is going to be the best year of your life. And I spent my whole 25th year fighting cancer. And the fatigue that came along with it was something that I had never experienced before. And I still, after a couple months have gone by since I've been in treatment, and I still suffer from the general fatigue every day.
Yeah. I had about the same as when I was going through radiation, especially. The fact that, again, I couldn't eat, so I was just losing so much muscle and so much weight so quickly. I was just tired all the time. I'd go do radiation early in the morning and then just go back and lay on the couch because that's all I could really do. And although I do think that these past few months I've done pretty well with my energy, I still have incredible trouble concentrating, and just it's taken me a while to get back to the office and actually be able to do my job, because by the end of it, I'm just mentally drained. Even if I had like a very low key day, just talking to people all day is draining for me, and I still don't have the muscle to like run around the building and do all the work that I need to do. And you just don't like think about those things and how much they really affect you until it happens, and then you're just like pushing yourself to recover, but you can't do it too fast because you're just going to be burnt out. So it's a lot of give and take mentally and physically.
Yeah, I like what you were saying, Madison, that it's not like everybody says I'm fatigued, but this is, a totally different level of fatigue. And Sam, as you said, it's also that muscle, right? You lose muscle. And even for somebody, you've always been very athletic, you noticed that your stamina just wasn't there. And then you brought up the cognitive part too, that your concentration and focus has not been the same. It's better, but not quite, what it used to be. And it's a gradual improvement. Before we move on to the next question, does anybody else want to share any of their experiences in terms of, the physical or emotional challenges?
Well, mentally, because it's brain cancer, it is like affected my personality. It's on the personality part of my brain. So that's been really interesting. Because not everything I say or do is me. Like I'll get really angry. But it's only temporarily, and then eventually I'm able to kind of snap out of it. So that's been an adjustment for me and my family to kind of learn how to deal with it. And we actually named my tumor. So his name is Frank. And so we'll be like, oh, that's Frank. That's Frank talking. It's not me. And my family's been so good about just realizing that that's what that is and that it's not, I'm not that terrible.
Yes. And you had shared that you shared that information about Frank with your roommates, right?
Yes, I have. I've let all my close friends know, but it seems to be mostly with my family that it comes out. And it's lesser now. It was closer to treatment and all of that, or radiation, I guess I should say.
For me, I remember during treatment, I was probably in the last cycle of chemo, and I was walking with a friend, and I remember being so, I guess, beat down and defeated that I was just like, I told my friend, I was just like, um, I don't think I want this body anymore. Is there any way that I can just like trade it in like the way people trade in like used cars? And I was just like, it was almost like I had this mentality that even when all of this was said and done, that I didn't even want this body anymore. It's not, I guess you could say I used to be somewhat of a perfectionist before. And to me, this body was just something that was ruined already, and I didn't want to have anything to do with it. Like, can I get a restart in life, you know? And but these days, I think I have regained my energy and all that. But there would be, pockets of time where, without explanation, you'll just get a little more tired and discomfort. That it'll take you out of the zone when you're out with like friends and family and stuff like that. But I'm grateful, and I'm grateful I didn't trade in my body.
So I'm going to shift gears to something that you all have shared with me at some point, about how the experience of getting diagnosed and going through treatment affects your relationships with family, friends, and peers. And if you can talk a little bit about that. Some of you have already touched upon it, but if you can go a bit more in depth.
This topic is something that I struggled with the most throughout my cancer treatment. I felt like I had established really strong friendships in high school and in college. And I felt like it was common decency when you're going through anything for your friends to show up for you, especially cancer. And I was really, really let down with the people that didn't show up for me. And I thought about it every single day throughout treatment, and I still think about it today. Just a simple phone call or a text message from your friends can make or break your day. And to not hear from people who you have been friends with for 10 plus years, one time throughout your treatment, was really devastating for me. And now I'm at the point where I'm trying to reestablish what those friendships look like and where we stand now. And it feels wrong that my friends let me down, and I feel responsible to pick up the pieces.
Yeah, I think I can relate to some of that, but not quite to the extreme. I just think at my age, nobody knows how to deal with this. And prior to me going through this, I don't think I would have known how to deal with this either. But I think it is so unfair that like we're the ones who are left hurting because of that. Like it sucks.
And I think to add on to that, there's no right way to support a friend with cancer, but there's definitely a wrong way. And I think everyone has to determine for themselves what that looks like.
For me, I really struggled telling anybody. When I found out, I had told, of course, my family and my aunts and uncles, but I really couldn't tell anybody else. I told 4 or 5 of my friends at the most. I may have even told less people. I didn't want to burden anybody with what I was going through, and I didn't want to even have the conversation with anybody. And although my family was there for me more than they were there for me the whole time, and the few friends that I did tell constantly checked in on me. I then had trouble after I completed everything because all of the friends that I did see later had no clue what I had gone through. And it caused me a lot of anxiety having to talk to somebody when they see this big scar from my Adam's apple onto my ear, and I'm talking different and I can't eat the same food. So I now have to have this conversation with a lot of other people again. So I almost wish that I just told everybody, but at the time it was the best thing for me just to keep it to myself and prepare for what I was about to go through.
Which I think highlights again that different people cope differently. And so for you, it was really just sharing it with your immediate family and the people immediately close to you. I didn't mean to interrupt though, Andrew, if you wanted to share anything on this topic.
For me, it was a little bit different. It was like my friends did show up for me, but it was almost like it was hard to relate because of the things that I was sharing. It was hard to, I guess, imagine what severe, illness is, or it was hard for them to, because they're concerned with their normal people problems and their normal people lives and their ambitions with career and everything like a normal person would. And I think my friends tried their best, I think, to understand and lend an ear to all the struggles that I was sharing, but they can only imagine it to such an extent, which is why at the time I actually wish I had fellow cancer patients to talk to about this, but for some reason I didn't have access to others my age who had cancer. There were a few people that promised to show up to my chemo sessions and ended up not coming. And rather than trying to occupy like mental space, resenting them, I try my best to have like compassion for them, because they're everyone has a different life experience, and because of that everyone has a different tolerance for the subject matter and like witnessing their friend deteriorating or whatnot. So I just try to look at it with compassion and be at peace with something like that for their absence.
Well, I think you brought up an interesting point, is that even when they did show up, Andrew, it is very hard for people that haven't gone through something like this, and they are young. And so life experiences, hopefully for them, have been pretty smooth to that time. So that ability to truly understand from an emotional perspective is going to be somewhat limited. And I do think that that's where sometimes the programming that we have through YAP and connecting, as you said, with others that have been through it can be helpful. And I think that's why this panel, again, can be helpful. And I know that for many of you, there's been hardships there, but I know that several of you have shared some of the surprises, because there have been people that have come through. And I think that's part of what's interesting as well, And I don't know if any of you want to share some of that.
I think there's people who you're surprised that show up for you, and that's so amazing. And then there's people who you're really surprised that maybe didn't too. It's a very interesting like duality, I guess, between who shows up and who doesn't. But I am very grateful for like all of the people that this has brought me closer to. And I'm also grateful for like seeing who has not reached out, because I I know where our relationship stands now, in my opinion.
I can agree with that. I think that on the flip side of being let down by a lot of people, there were quite a few relationships that were strengthened and mended because they really surprised me in showing up for me.
So would you be willing to share how the cancer experience has just changed how you see yourself and how you defined yourself, if it has, and how?
I think that my cancer experience gave me a greater sense of self. Prior to this, I would say I was a pretty anxious, timid person. And when this happened, I really had no choice but to dig in and fight the fight. And I really felt like there was no other choice. So when you're faced with something like this, it really does change your entire being. And I think that on the other end of my cancer treatment, I am an entirely different person.
I think that I look at things a bit different. I hate to go back on it again, but food especially is like, I was sitting eating lunch with some of the guys from work, and without really thinking, I was just eating, and then it kind of hit me that 2 months ago I wouldn't even come close to eating this, or just appreciating what is in front of me and what I'm eating. I mean, when I can taste something and it tastes like it used to, it brings me completely new emotions. Like I had barbecue a month ago, and it was like the best thing I've eaten in months, and I just like couldn't stop eating it and just being so happy about just something that I just don't think about. Like before, I would just say, "Oh, this tasted good," but it's like, "Oh my God, like, you gotta try this. You gotta have this. This is delicious." So it's like the little things that I don't really think about. I mean, I felt it was a huge accomplishment for me to touch my lips with my tongue. Like I appreciate the small accomplishments now, and I hope that makes me a happier person, and that I'll continue this so that if I do know somebody that is going through what I'm going through, it has gone through, like I can help them and just help more people kind of get through and be happier.
But I like that it's given you that appreciation for some of the things we all take for granted often.
If I can build off what Sam was saying, like I remember during treatment, I lost my ability to form sentences or grammatically correct sentences, and I never knew that was a gift. I never knew that, I don't know, like being able to draft an email to HR about my leave of absence in 2 minutes was also a gift, because it was taking me 20 drafts at that point, because it just didn't make sense to me grammatically. I remember that when something as simple as water not tasting good, I didn't know it was a gift to taste water properly, little things like that. And but for me, when I first got the call about the X-ray not looking normal, I remember that they didn't tell me that it was Hodgkin's yet, but they had just told me that it was just a really large tumor in the center of my chest that was, it was it was sitting above the heart and in between the lungs. And I was like, there's no way I'm going to get out of this. It's huge, right? And I remember just reflecting on my entire life at that point and being like, if I die in the next few weeks and few months, how unsatisfied I would be at how I had lived my life up to that point. I had a very classic story of like going to all these big cities to chase my career goals. I was away from family, away from home, trying to do this with these very, disillusioned dreams that I would have been pretty upset had my life ended so much sooner. So this was quite a wake-up call, I want to say. And you don't have the opportunity, of course, to wake up unless you've been asleep this whole time. So it might be an unpopular opinion, but I think I'm grateful for having this experience and having it wake me up to this life that perhaps I was driving on autopilot. My priorities have changed. The things that I've treat with importance is completely different now. I try to have a more spiritual life, and a lot of friends would say, you've only turned to spirituality because you're afraid of death now. But I think it's anything but that. I think it's about living your life with the acknowledgement that death is a very possible thing, even at the age that we are. I used to be the guy that, always buys organic at Whole Foods and would jog like 3 to 4 times a day. Like, how is it even possible that this cancer that's not even genetically, it's not a genetic cancer, I think it's an environmental cancer, is what one of my oncologists have told me. And I guess it's just changed my outlook on life forever, in a sense.
I think that to build off of having a new outlook on life, a lot of people around you will say to you all the time, like, oh, you must have a really great brand new perspective on life. And I feel like while I do have a new perspective, more importantly, I have a bigger attitude about life now. And I'm only going to do something if it's going to enrich my life and make it better. And I kind of have taken on a new selfishness and decision making, which previously I was a big people pleaser. So that's done a kind of a 180 in my life as well.
Yeah, and I'm glad you shared that, Madison, because I think it really affects everybody differently. And I think sometimes, learning to set those boundaries and being better about self-care is so important. So I'm glad you shared that as well. Before we stop, because we have only a couple more minutes and we'll open it to the audience, does anybody else want to share anything in terms of how it's changed your sense of self, your identity, what's meaningful to you in life? And that same vein, does anybody want to share anything else?
Yeah, I do think I'm just so much more grateful for like every little thing. Like I never used to be someone, I like my major. I'm sports comm and advertising, so it's very fun, but I've never been someone who like loves school. And now I'm so content even doing the schoolwork I don't like. I'm just so happy to be here that like when people are complaining about it, I'm like, I can't totally relate to that. I'm just so grateful to like be back here and for every little thing. And I feel like the same has happened like with my family and stuff. And we just celebrate so much more. So I'm very glad we have that new perspective and all the new celebrations.
I did want to add that, one of the things that sometimes people feel, and it's wonderful you all are at that point where you're feeling that gratitude. And I think that that can coexist with also at times feeling, as many of you shared, also feeling unhappy and why did this happen? And, with the hardship. So, as we're getting to that point of opening up to the audience, I think it's important to realize that both can coexist within you, right? You can have this part that's really grateful and appreciative for the little things in life. But there's also a part of you that may at times feel, upset or angry about the hardships you're still facing and, the fatigue you still may be struggling with. So it doesn't have to be one or the other. They can both coexist within you at the same time. And I think you would all agree with that, as you've brought up, over the last 50 minutes, that it's not one or the other. You can have both, right?
Yeah. I am very grateful for how my whole situation went. I mean, my surgery was supposed to be 11 hours, and the tumor was smaller than they thought, so it ended up being only 5 hours. I'm talking again. I mean, I've done so many things that doctors said I might not be able to do. And so I'm so happy that I'm doing well. But I do have times where I get upset and I'm angry. But during those times, I always am able to just tell myself that everything's going to be okay, and that, I might not be able to do something that I used to be able to do, but it's fine. And I can pivot and I can work around it. And I'm extremely thankful that I have family that supports me when I am upset. And they do acknowledge like the small things that I'm able to achieve. So yeah, I agree that there's ups and downs.
So I'm going to go ahead and turn it over to Sarah and Paige, because I see we've had comments coming throughout the discussion. So I'm going to turn it over to them and to questions.
Sure. Thanks, Christina. And I welcome more questions in the chat. Right now, we only have the one, but I'll pose this to the group and feel free for anyone to hop on. Joanna mentioned that she said, I was angry with myself when I received my diagnosis of cancer. I felt I failed my children, nieces, parents, and husband. Have you felt this burden? So if anyone wants to touch on that feeling of if you did feel that burden that Joanna is mentioning, or if you didn't, just any comments on that.
I definitely, sorry, go ahead.
You can go,
I
sorry.
definitely can relate to this. I don't feel like I failed them, but I felt like having the conversation and telling people that I had cancer, I was breaking the heart of everyone I cared about. And I felt a really strong responsibility to have a positive outlook throughout and put on a brave face and not break down in front of people, and kind of give them a sense of comfort. And that taking that on definitely was a larger burden than I anticipated.
Yeah, I completely agree with Madison. I felt very guilty, even though there's nothing I could do to not have this cancer. I mean, my doctors still don't really know how I got it at such a young age, but I felt this extreme guilt for my family, and that like I was not going to break down in front of them, and I was going to be positive the whole time, and even going through radiation, just having a smile and saying like, it's okay, we're going to be fine. You know, we're all going to be fine. And it was hard to keep that smile and to just power through it. But I definitely didn't really have guilt of why me until the end. It was just more like, why do I have to put my family through this during everything I'm going through, that they're going through it with me. I felt very guilty about that.
Yeah, I think it would have been really easy for me to feel guilty or angry. And I think my family were like just so graceful in how they handled it that it helped me to not feel that way a lot. Because of the timing when I was diagnosed, my younger sister, who's 2 years younger, ended up staying home a semester of college because we weren't sure what was going to happen to me and how much time I had. And she ended up driving me to radiation every single day almost, and never once complained. And I think if she'd complained or made it seem like it was a burden to her, then I would have felt more guilt and more angry at myself. But I think they all just were so caring and just didn't make too big of a deal out of it, that helped me a lot.
I can definitely agree with that. My mom drove me to every single radiation, every single chemo, every single doctor's appointment. My boyfriend and my mom took me to the IVF ultrasounds every other morning at 7 a.m. for 2 weeks. So while I felt badly to burden them with that, it definitely made them feel better that they were there with me. And sometimes you just have to let that be.
And I think that's such a great point, that it helps those in your life who love you to be able to provide some type of support. And oftentimes that's in a very concrete way to be able to do something, can be very helpful for them to feel in some way useful. Do we have other questions or?
I think that's it. Christina, I think it would be a good time to wrap up if that's okay. Christina, do you want to say anything before I move to the slides?
No, I just really want to thank the panelists for being here. I thank you. It's such a deep gratitude that I feel, first of all, to know all four of you and to just work with you and to know you. So I really want to thank you for allowing me to be part of your lives. And I really want to thank you so much for doing this panel. I know it's not easy, and I'm really, very honored that you've done this. And I'll turn it over to Sarah. Thank you, though, so much.
I echo Christina with her gratitude to you all. So lovely to see all your faces today. I'll end with a quick YAP plug here. If you are not aware of our young adult program, here are our general offerings. I won't go through everything now, but just leave a second for you to check out any of our programming, and we're more than willing to chat with any young adult patients on the call, or anyone who knows a young adult that may be interested in. We have several different supportive programmings that we have active at all times. So those are all laid out here. And then lastly, here's our contact information. So the easiest way to contact us is our email, which is YAP at dfci.harvard.edu. And we'd be more than willing to set up a call with any of you to let you know more about what we have going on in our program right now. And excitingly, if you are a young adult on this call right now, we have a Spring Bash coming up on Saturday from 12 to 2:30 at Time Out Market, that all of our young adult patients are welcome to come and bring a guest, and it'll be a really great place for our young adult patients to gather and connect. So again, I'll stop sharing, but gratitude for you all on the panel and you all who attended today, and I'll turn it over to Becca for Blum, and thank you for hosting us and organizing everything.
Great. Thank you all so much. Thank you to the YAP team. And I really want to thank Catherine, Madison, Sam, and Andrew for giving us your time and just everything you shared with us today. I think this is really valuable, and I'm very excited that we're able to have this hosted live, and we'll have it on our Blum YouTube channel playlist, as well as our digital resource center. And I learned a lot myself just watching this, so very valuable. Thank you all so much, and I will finish this out right now and stop recording. So thank you again.